What you should do starting now to improve your egg quality in the next 3 months. Hi, friends. I'm Dr. Natalie Crawford, a board certified OBGYN and REI. So I'm a fertility doctor. And today I want to talk to you about egg quality, which is something that is often misunderstood and not discussed as much as an actionable item that you can modify for your fertility. Before we dive in, I just want to say a huge thanks so much for being here. Please like, subscribe, share, comment below, and also don't forget to check out my book, The Fertility Formula, which is now out, and you can learn much more about this topic. I want to dive in by starting to think about what egg quality is and why it matters. Your eggs are inside your body your entire life, and you may not be aware that they're actually their highest when you're a 5-month-old baby inside your mom. So at that point, you have 6 to 7 million eggs. By the time that you're born, you have 1 to 2 million. By the time you start your first period, you have 500,000 at most left. And so women are born with all the eggs they're ever going to have, and they're going to run out of them over time. So eventually, you will be out of eggs, and that will mean you can no longer get pregnant or you won't have hormones made anymore. But much more than the number is the quality of the eggs that starts to limit your ability to get pregnant and stay pregnant. Quality has been simplified in the fertility field to be age only, and age is a huge part of egg quality, but it's not everything. And that's why this discussion is so important for us to zoom out and think about the big picture. Egg quality to me is both the genetics, so you have to have a good base, a good foundation, so the genetic normalcy, but also the competency or the ability of the egg to function. And function means many different things. It means it has to appropriately respond to hormones from the brain, it has to make hormones, it has to have mitochondrial function. So it's a lot more about the metabolic and cellular health. And that becomes extremely important when you get pregnant because the sperm fertilize the egg and the mitochondria from the egg control all of embryo growth and development. So we really want to make sure that we're thinking about both of these factors. When it comes to genetics, let's think about what genetics is. Your eggs are actually held in a stage of cell division called metaphase of meiosis. This is when your chromosomes are lined up. The female chromosome is 46XX, so 23X, 23X. They are actually in perfect little pairs, held apart by these meiotic spindles, which are proteins that hold the chromosomes in perfect position. Very interesting fact is that your chromosomes stay like this until you ovulate. At this point, they separate. 23X actually go into something called the polar body, becomes trash, and 23X are left in the egg. But it is wear and tear of time, tincture of time, and inflammation can break down these proteins. So let's just think about proteins throughout our whole body. As we get older, we get wrinkles, back pain, joint pain. Our body starts to break down just from wear and tear of time. And a lot of this is accelerated in the context of chronic inflammation. And the exact same thing happens inside our eggs as well. My favorite analogy for this is to imagine your chromosomes are children, kindergartners in alphabetical order. Now, the longer I've asked them to stay in alphabetical order, the more likely somebody's going to get out of place, even if they're the most well behaved children on planet Earth. Meaning, if you ovulate at age 20, your chromosomes have been sitting there for 20 years. But if you ovulate at age 40, they've been sitting there for 40 years. Wear and tear of time does matter. But a huge proponent of this about accelerating this decline is on chronic inflammation in your environment. The reason why this is so impactful, if we think about it, is imagine to the line of kindergartners, I bring in puppies and kitties into the room. That's inflammation. How many are going to stay in perfect order now? Many, many less. And this is why the competency of the egg is so severely impacted by chronic inflammation and one of the top drivers of chronic inflammation, which is insulin resistance. And to make matters worse, chronic inflammation also impacts the number of eggs in addition to their quality. So, egg quality is very important. Yes, you can't undo everything about time, but even if you are older, starting to pay attention to your egg quality matters more. Now, a question I get asked all the time, well, if my eggs are in my body my whole life and there's nothing I can do about this because I already lived a crazy life in my 20s, so I'm not going to worry about this now. What we do know is that your eggs are inside what I like to imagine as a vault inside your ovary. And yes, tincture of time, wear and tear, chronic inflammation add up, but they are most sensitive to the world around them as you get closer to ovulation. So 300 days prior is the first kind of ring of exposure, but 60 days prior is the next. So 60 days before you ovulate is when you can have the biggest influence on egg quality. So that's great because now there are some things that we can do. So, what can we start to do to improve our egg quality when it comes to this? Let's reduce the inflammation coming into our body. Chronic inflammation causes oxidative stress, changes mitochondrial function, and of course, this impacts just the chromosomes, but also the functionality. Inflammation disrupts the environment. It's like bad weather for your eggs. There are so many things that we're exposed to that cause chronic inflammation, but a lot of them are choices that we are making. So, how do we improve chronic inflammation? Number one, let's do it by changing the foundation of our day. And this is going to be with sleep, stress, and exercise. Let's say sleep is the top priority on this one. When you sleep, your body can heal. It can go heal up some of that chronic inflammation. It also improves your insulin sensitivity and it allows you to start the day fresh. The concept that I like to think about here is your inflammatory burden, the amount that you are exposed to every day. The world's inflammatory. So if we imagine your inflammatory burdens right here, choices you make add to this burden or decrease it. And this matters because when your body is busy dealing with this inflammatory burden, one, it can't do its other functions, but two, this is the damage that's adding up to your eggs. And the larger it is, the worse the damage. So, getting sleep, if you get more than 7.5 hours, you're improving your inflammatory burden. If you get less, you're worsening it. So that's one metric here. And the sleep data is very specific. For every hour less of sleep that a woman gets, she gets fewer eggs retrieved, lower live birth rates. Men have lower testosterone levels, lower sperm count. So it's not just a luxury, it's a must do. Next is going to be managing chronic stress and exercise or building muscle. And I actually want to talk to you briefly about insulin resistance to understand this one. Insulin resistance is the idea that your body starts to build up a tolerance to insulin, and this is one of the top causes of chronic inflammation. Insulin's a hormone made from your pancreas. You eat food, food gets broken down into glucose. Glucose is the fuel for the cell. So you eat glucose burden, now you suddenly have insulin made. In its perfect world, insulin is a salesman knocking on the door of the cell opens the door, glucose goes in, life carries on. But insulin resistance means if a salesman comes to your door every day, the cell stops answering. This starts to happen when you have a higher constant glucose burden, often by ultra processed foods, the type of foods we're eating, those that have what's called a high glycemic load, frequency of meals, chronic stress. All of this causes our body to have a higher glucose burden. So the pancreas responds as it's supposed to and releases more insulin. But your cell gets sick of seeing the salesman, so stops responding. And that means it takes even more insulin from the pancreas. The salesman has to bang on the door so that it will even be opened or glucose can get into the cell. But insulin is not benign, it's a growth hormone. And this high insulin environment causes fat distribution in the visceral fat area, highly inflammatory. It actually changes how the ovary responds to its normal signals directly, in addition to changing egg quality. So, very impactful here. How do we change this? One is going to be to say, okay, let's stop the process where it is. And a fun fact is building and using skeletal muscle. Skeletal muscle has a transporter called GLUT4 that allows the cell to utilize glucose without needing insulin. So the more muscle you have, the more you activate it, you're going to stop the cycle of insulin resistance. So build muscle, strength training 3 times a week. Next is going to be work on chronic stress. And this is hard, but it's real. And I hate when fertility doctors say, don't stress about being stressed because that's so passive aggressive. The world is stressful. Let's have a game plan for it. So, one, cut out what you can, meaning say no to things, block people who are toxic to you, really be mindful of how you spend your time. Number two, cultivate 20 minutes a day where you can get that cortisol release. Cortisol is the hormone from your adrenal glands that activates your stress response, and it's highly inflammatory because your survival, let's say you see a bear and you need to run from the bear, your body wants to have fuel for your cells that's not dependent on when you last ate. So, part of the cortisol process is to break down stored glucose from your liver and put it into your bloodstream. So, chronic stress causes high cortisol, causes more glucose, causes insulin resistance. Chronic stress causes insulin resistance. So we need to give ourselves a cortisol release. And this can look different for all of us, but it can be meditation, mindfulness, acupuncture, journaling, walk outside, yoga, warm bath. There's so many different things. You need to carve out 20 minutes for you, not with your phone. Third, and probably most important and my favorite, is we need to understand how our bodies are made to work with our physiology and not against it. Meaning, when you are exposed to that stressful environment, let's say you have a bad doctor's visit, you got terrible news about your fertility. Suddenly now, instead of just stress eating or stress drinking, which are our normal responses, and what do? They actually worsen our glucose burden. What we need to do is say, my body can't tell the difference in this bad news appointment and being chased by a bear. and more glucose is in my bloodstream now. So now what I want to do is activate that skeletal muscle to stop this process. And 10 squats in place, a short walk, something to use that skeletal muscle can actually stop some of this insulin resistance cycle. So, sleep, stress, exercise, and diet. The foods that you eat are immensely important, especially once you understand how insulin resistance and glycemic load play a role. The general diet principles are going to be an anti inflammatory diet, high in fiber, high in fruits and vegetables, unlimited fruits and vegetables. We want to have good, healthy protein sources. Plant based protein is especially advantageous because it has fiber in it as well. We want to have dairy that's whole, not processed skim dairy. We want to have those healthy fats. Remember, cholesterol is the backbone for steroid hormones. So, avocados, olive oil, nuts, all wonderful. And we really want to avoid ultra processed foods. Those have that high glycemic load. They are not nutritious in any way that your body needs, and they are only inflammatory. So, just shifting that in the simple foods that you're eating can start to make a huge difference. Also, when it comes to this, taking a prenatal vitamin can be really helpful, especially though if we want to add to it vitamin D, omega 3 fatty acids, CoQ10, and of course, we need folic acid. CoQ10 specifically has been studied to support mitochondrial health. We know mitochondria, powerhouse of the cell. Doses of 600 milligrams a day have been shown to help with fertility and egg quality. That's an easy supplement with very few side effects that I recommend to all of my patients. And then if we want to look at the last one's going to be avoiding toxins. We know that toxin exposure decreases egg count and egg quality, can be associated with longer time to pregnancy, poor outcomes with IVF, and poor pregnancy outcomes. Some of the most concerning here are those endocrine disrupting chemicals like BPA and phthalates and PFCs. These come from plastics very often, Teflon, our environment, especially start within your home. So look in your home, get rid of nonstick cookware, get rid of any plastics that are in your kitchen at all. Be really mindful of food containers. Pay attention to your water. Make sure you have a good water filtration system, and also pay attention to your beauty products. And I've got a whole chapter on toxic chemicals, charts to help you look through your life and reduce your toxin exposure, because it's not about blame for your fertility. It's about controlling the factors you can. Your fertility is much more than luck, especially your egg quality. And we can't roll back the clock and change our age. We very well should reduce the inflammatory burden that we're exposing our eggs to. Hopefully, you guys learned a lot. Ask your questions below and check out the fertility formula.